Hi, I'm Dr. Kimberley Bell. I'm a doctor of physical therapy, and I specialize in working with people with dizziness, vertigo, imbalance, and unexplained repeated falls. A lot of times when I evaluate my patients, they've been suffering with these symptoms for years and years. In fact, the first woman I treated had been suffering with vertigo for 20 years. And I'm able to assess their vestibular system, identify the cause of their symptoms, and a lot of times resolve the symptoms in 1 or 2 sessions, depending on the cause and the findings. The frequently asked question I get from my patients is, why didn't my doctor assess this? Why didn't my doctor identify this years ago? Why have I been suffering for so long? And the answer is that the inner ear is a specialty within medicine. It's actually a specialty within the field of neurology. Not all neurologists are even comfortable evaluating the inner ear independent of diagnostic testing. So if you can imagine the specialty that a physician would have to go through to become first a physician, then to become a neurologist or an ENT, an ear, nose, and throat doctor. They also sometimes specialize in the inner ear. And then beyond that, they would have to become an inner ear specialist. So it's a subspecialty within medicine that's very uncommon to find in any physician. That's why a lot of people are walking around with undiagnosed inner ear problems. They simply just haven't gotten to the right physician that knew how to properly evaluate and treat them. So my recommendation to you, if you're suffering with dizziness, vertigo, imbalance, or unexplained repeated falls, is to find someone who specializes in the inner ear at the Vestibular Disorders Association website, vestibular.org, and get some relief today for your symptoms. Thank you for tuning in to Frequently Asked Questions with Dr. Kimberley Bell. I look forward to hearing from you with your future questions at betterbalanceinlife.com.